Ackerman, and today the topic is ear, nose, and throat. They are all connected, and when there's an issue with one, it can absolutely affect the other. I know this firsthand because it is something that I had to deal with as a kid growing up for quite a while, actually. Dr. Scott Ackerman is one of the First Coast leading oncologists, and he's here today to talk about common ear, nose, and throat questions. Welcome, Dr. Ackerman. You brought a friend along with you today.
Yes, I brought with me today Dr. Jeff Brink. Jeff is specializes in cancer of the head and neck. He's really an otolaryngologist, so it's ears, nose, and throat. Not just cancer, which is what I interact with him a lot, but he also deals with other problems of the ears and regarding hearing. He does the problems with the tonsils and adenoids and all those sort of things. So he's here today to give us some insight on problems with the head and neck area.
You were my guy growing up. You were the man that I had to see all the time. And my grandma, she used to tell me, don't put anything smaller than your elbow in your ear. Is that true?
Well, that's not really true. Wax is something that is, natural to the ear canal, helps with protection. It's a barrier, it adds moisture. But some people want to try to keep their ears cleaner than just the natural process of what the body does. So you can use a Q-tip. Putting a Q-tip in your ear in a proper fashion, putting it no farther than the head of the Q-tip, down the center of the ear canal, and then making contact with the edges and doing it in a twisting out fashion will allow you to clean the ears without injuring yourself. If you use it improperly, you can push wax down and the wax can get impacted, and then you can have problems with pain and pressure and water trapping and hearing loss, and maybe even a perforation of the eardrum.
And there's little things that we should be aware of that tie into the ear, nose, and the throat. But you said in particular maybe small lumps that you might find. Yeah,
lumps and bumps and masses of the neck are concerning. People come in all the time, and if they are changing over time characteristic-wise, getting larger or becoming symptomatic, causing people to notice them when they turn their head or swallow or become painful or tender. We're also concerned about skin changes to the neck, the face, and the scalp, growing skin lesions, color changes, border changes, and then certainly things of the mouth, masses or ulcerations that don't go away or don't heal.
So once you've done kind of extensive look at what is going on with all of those things, then you may need to refer them to Dr. Ackerman. Is that correct?
That is correct. And a lot of times if I don't get a healing process or have a persistent mass, I will do a biopsy, sometimes in the office, sometimes in the operating room, and then if we detect cancer, then I send my patients over to Dr. Ackerman for further care. And
Dr. Ackerman, so how do we know
when patients have these, like Dr. Brink is saying, these lumps that don't go away or these sores that are in the mouth that don't heal, we want to have them seen by someone like him to get some tissue, get a little biopsy. So biopsy is just cutting a little bit of the tissue, and then we have a pathologist look at that tissue under the microscope. And frequently it's nothing, it just could be a reactive lymph node because of an old infection or something. But if it's something that's cancerous, then we need to talk about a strategy to eradicate that cancer. Frequently that strategy almost always includes some sort of surgery, which Dr. Brink does, and many times, oftentimes, radiation is involved as well. And occasionally, we need to add chemotherapy also. Luckily, with most cancers of the throat and the neck, we have, despite the fact that a lot of them are diagnosed in a slightly advanced stage, even those we're able to cure them at a pretty good rate.
Well, that's good. One thing that I went through when they had put tubes in my ears and then I had the adenoids and tonsils removed. Tonsils, what are they for? And is it something that you should just automatically get removed? Or
no. Tonsils are part of the lymphoid system, which participate in the immune system. And they are, in conjunction with the adenoids, which is also lymphoid tissue in the back of your nose, they filter anything foreign or infection that goes through your mouth and nose. And so that filtration process results in a response that creates antibodies, which are the molecules that fight infections. And over time, tonsils can get used up. They may have little things growing on them, or they might be unequal in size, or get little tiny stones that cause bad breath in them, or cause swallowing difficulties, hindering the swallowing, or even lead to snoring. So we talk about, in those cases, taking tonsils out. because at some point, usually within the first 8 to 12 years of life, tonsils get used up. You don't need them anymore. So we talk about taking them out if you have problems, and those problems can even occur later in adulthood too.
Now, once those tonsils are then removed, do we have to worry about any kind of cancers or anything in those still?
The tonsils are a fairly common place to get cancer of the head and neck area. We're seeing more of it all the time. And even though the tonsil's removed, as a child doesn't mean you think it's removed, but it's not completely removed. There's still some tonsil tissue left deep in the mouth. And the cancers, they're not necessarily of that tissue, but they're really the cancers of the mucosa that lines the oral cavity there. And so we see cancers of the tonsil. It's really the tonsillar fossa, or that area where the tonsil was, if you've had it removed. So just because it was removed doesn't mean you can't get cancer of the tonsil. Okay. And we have the same situation in breast cancer. Women may have a mastectomy to prevent breast cancer, but sometimes those mastectomies don't remove all of the breast tissue. Mm-hmm. And there could be a small amount of breast tissue left, and that could become cancerous as well. So even though you have a mastectomy to prevent breast cancer, or tonsillectomy, those areas, it's infrequent, but you still can get cancer in those areas.
And we got about 30 seconds, but let's talk about one other thing. People that have some swelling here, or when they sleep, their tongue seems to fall back, and it's sleep apnea, right? Yeah. Is that what this is?
Sleep apnea, basically excessive enlargement of tissue or redundancy of tissue that causes airway obstruction. You'd be concerned for people that are excessively snoring. 40% of all snorers have sleep apnea. So if people are snoring loudly, waking up frequently, very tired in the morning or tired during the day, loss of concentration or memory, then they should consider doing a sleep study or a polysomnogram, which can be done at home in an outpatient setting or in a hospital.
This is important because it could lead to heart disease and so many other things.
Correct. Hypertension, early stroke, early heart attack, diabetes, things like that.
Great. Thank you both, Dr. Ackerman, Dr. Brink. Thank you both for being here. And we'd like to thank Dr. Ackerman for sponsoring this segment. And also, well, if you have any questions regarding today's topics or any other health questions that you might have, just connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.